Unlike humans, it's generally very hard for a cat to communicate that something's bothering them, be it allergies or something more serious. It falls back on the pet owner to deduce what's what. So, how can you tell if your cat is feeling off? Let's dive into these 20 common signs that might indicate a visit to the vet is needed. First up, diarrhea. While an abnormal poop consistency could just mean your cat had a bad meal, it might also signal a more serious issue, like a virus, bacteria, or even worms. If your cat's diarrhea lasts more than a couple of days, it's definitely time to contact your vet. Next, what about when your cat isn't eating like they used to? Lack of appetite in a cat that once ate heartily could be a sign of something complex and internal going on. The list of issues associated with a decrease in appetite is long and varied. So if your cat's not interested in food for more than a day, it's a good idea to get them checked out by a vet. Blood work and diagnostic tests can help identify the root cause. And what if your cat seems overly lethargic? It's normal for pets to have periods where they sleep more than usual, but significant changes in behavior warrant attention. The lethargy could be anything from the weather to a stomachache. However, if your cat seems unusually tired or inactive, it might be fighting off a bug or illness. When in doubt, give your vet a call. Now, let's talk about vomiting. Seeing your cat throw up is never pleasant. While occasional vomiting can be due to hairballs or eating too fast, frequent vomiting could be a sign of something more serious, like acid reflux or a gastrointestinal issue. If your feline friend is vomiting consistently, seek help from a professional. Another one is increased thirst. If you notice your cat drinking more water than usual, it could be an indicator of kidney issues, diabetes, or a urinary tract infection. Increased thirst is not something to ignore, as it often points to underlying health problems that need veterinary attention. Then, there's weight loss. A sudden and dramatic drop in weight for any mammal, including humans, should generally be cause for alarm. This is because weight loss can signal a range of issues, from cancer to viral illnesses. To ensure your cat isn't suffering from something serious, have a vet run some blood work. Another serious sign is bleeding. This one's straightforward. If your cat is bleeding, whether from a visible wound or in their poop, it's a clear sign that something is wrong. Minor cuts might be treatable at home, but persistent or internal bleeding needs immediate veterinary attention. And irritability is another sign to watch for. As cats age, they can experience cognitive decline. But if your younger cat is acting weird, out of sorts, or cranky, it might be more than just a bad mood. Changes in behavior like this can indicate that something is bothering them that isn't immediately visible. A vet can help determine what's going on. If there are wheezing, asthma affects a small percentage of cats, but it's something to watch for, especially in kittens. If you notice your cat wheezing or having trouble breathing, your vet can help treat the condition with steroids and puffers. Let's move on to coughing. Believe it or not, cats do cough, and it can be a sign of concern if it's accompanied by weight loss or other symptoms. If your cat is hacking up a lung and it's not just a hairball, your vet might prescribe antibiotics in case of a bacterial infection. Discharge from the eye or nose can also be a red flag. A healthy cat's eyes are typically clear and bright, and their nose should be cold and damp but not dripping. Any ooze or discharge could indicate an upper respiratory tract infection, conjunctivitis, pneumonia, or allergies. If you notice these symptoms, it's time to see the vet. Hair loss is another sign that something might be wrong. There are many reasons your cat could be losing hair, from allergies to infections to endocrine disorders. The only way to diagnose substantial hair loss is to have your pet seen by a vet. While it might not be serious, it's always better to be sure. And speaking of grooming, over-grooming is a concern. Some cats groom themselves excessively as a form of self-soothing, but it can also be due to itchy skin or other underlying issues like skin parasites or allergies. Excessive licking can cause lesions and inflammation. So if you notice your cat over-grooming, check in with your vet. Swelling is another clear sign. Whether it's an infected wound or a puffy abdomen, swelling is almost always a sign that something serious is up with your cat. Don't ignore it. Get it checked out. Trouble jumping can also indicate a problem. Cats are known for their agility, so if you notice yours is avoiding jumps or struggling to move around, they might be suffering from a muscle ache, arthritis, or even a torn ligament. Persistent issues with mobility should be assessed by a vet, and they may require an X-ray. Bad breath isn't just unpleasant, it's also a warning sign. Almost 75% of cats over the age of 3 have some form of dental disease. If your cat's breath smells bad, it's likely the first sign of dental problems that need attention. Regular dental checkups can help prevent serious issues. Increased meowing could also signal a problem. Cats meow to communicate with their owners, but excessive vocalizations, especially when paired with other symptoms like increased thirst or appetite loss, could indicate that something is wrong. Pay attention to changes in their vocal patterns and consult your vet if necessary. Pale gums are another indicator of health issues. Your cat's gums should be pink, so any loss in color could mean they're not getting enough oxygen or iron. This is a symptom that definitely warrants a vet visit. A fever is a clear sign that your cat is fighting an infection. A normal feline temperature is between 38 and 39.2 degrees Celsius. Anything higher is considered a fever and usually indicates your cat is battling an infection, whether bacterial or viral. A trip to the vet can help identify and treat the cause. And finally, seizures. Seizures can be incredibly scary to witness, but they're not always a cause for alarm. Sometimes the issue can be as simple as a dietary change. However, seizures can also be linked to serious conditions like liver or kidney disease. If your cat experiences a seizure, consult your vet to determine the cause and appropriate treatment. If you found this video helpful, please give it a thumbs up and share it with your fellow cat lovers. Don't forget to subscribe to our channel for more cat care tips and advice on keeping your furry friend healthy and happy. Have you noticed any of these signs in your cat? Share your experiences in the comments below. We'd love to hear from you. Recognizing the signs that your cat is sick is crucial for early intervention and effective treatment. Regular vet checkups and being attentive to your cat's behavior can ensure a long, healthy life for your feline friend. Remember, when in doubt, always consult your vet. Your cat's health and happiness depend on it.